So we're ready to start our session. We make sure that the eductor 1 device is on, and we double click the icon on the desktop to start the software. You'll see it's quite quick. Okay, so device is found. This panel comes up reminding us how we should put the harness on correctly. Just remember that the headband should have the cable coming out of the right side. So we close. Okay, here you see these buttons grayed out. The only button that we could press is the password. So we enter the software. Okay, and we go into demographics. Here you will see demographics a little bit different than previous versions. Basically, it's easier. You will find it much quicker and easier to go through demographics. And secondly, it's according to GDPR and to respect the privacy of our clients. So in this way, the patient list is not shown here if we have a double screen and our patient is watching. Okay, if we want to see your patient list, you can show patients here, but for our purpose, I won't. So we can be according to GDPR. So we can enter a new client, press new client, and we'll have child demo 1. Okay, let's consider this little child male. Let's say he's 6 years old, so he was born on September 1st, 2013. Let's say since I'm in the vicinity of Athens, I will put Athens here. Greece. Okay. We go to edit birth data. Okay. Okay, for our purpose, because I don't want the list to show again when we go back for the client list, I will not take this yellow panel off. So we say it's in Europe, okay, and we see what time it's born, the baby. It says nighttime. Is usually quite accurate, okay. So I double click, actually I should double click on the area it's born, but for our purposes, since it's hidden in back of this yellow panel, I will not. Okay, because if I took it out, the list will be shown back here. So let's continue. In order to go to the SOC panel, we have to save the current client. Okay, and here it's in bold, and we can go into the SOC panel. Remember the SOC index, it stands for suppression, obstruction to cure. Basically, it's the health lifestyle of the patient and what's blocking them to cure. So, for our instance, our child, let's say he's taken out his tonsils, so that's one organ removed, and since he has a surgery done to take the tonsils out, we put 1 for the injury. Here we can ask the client or the parents of the client, has he gone through any other kind of surgery? Has he broken any bones? Has he gone through any accidents, let's say? Has he hit his head and maybe, you know, severely and maybe unconscious? Or has he gone through any past traumas, psychological, let's say separation of parents, death of family, etc. Those items, we count them and we put them, we add them here. We ask if he's taking any medication at the moment, possibly antibiotics or antihistamine or what have you, any other kind of medication. I hope he doesn't smoke. He's too young to smoke, so we leave that at 0. Stereotype drugs in the last year, that includes hormones, that also includes any cortisone if he's taken. Okay, we leave that blank for our demo purpose. Usually in children they don't put amalgam fillings. Very rarely I've seen that done in the past few years, but in case we always ask. Street drugs, again, he's too young to really do that. I hope he doesn't use street drugs, but of course, if it's a teenager, you can ask very discreetly, and perhaps do you smoke occasionally, anything other than a cigarette. You could very diplomatically tell him or her so that he says the truth. Of course, there's always ways for you to find out from the matrix, because the matrix is a tattletailer. We see a lot of secrets coming up there. If you know how to look for them, many things come up. So allergies, usually, I'll discuss them here with them, but I won't put anything because I always like the matrix to tell me about the allergies and the program. I want them to see the dynamics of and the power of this device and the software, because really it says everything. So mental factors. Mental factors are things that they may be stressed about, they can't find any solution to. A child may have maybe bullying at school, or issues serious issues that he's stressed about. So you can discuss this with them, put a number here. Responsibility, 0 to 10. How responsible are you for your body? 0 to 10, 10 maximum responsibility. So this is a trick question we always ask, even the children. It's good to ask them because it makes them more aware of what they should be doing. Sometimes children get the answer right and they say, I'm responsible for 10, but most of the time they usually say, 6 or 7. And we'll say, why? Why? Who's responsible for the other 3 or 4? And they may say mom or dad or whatever, and we say, no, it's you and only you. You are responsible, for instance, to brush your teeth, morning and night, let's say, minimum. You are responsible for drinking enough water, eating correctly, etc., etc. So we kind of give them a little touch of going into the healthy way of life and being responsible for what they're doing. Percentage of processed foods or fat in their diet. Let's say we have 3 for this child, but we can discuss this and how they eat in general. Have a little discussion with the child or the parents. Personal stress, 0 to 10. Okay, it's summertime. Usually they don't have much stress at this period of time. But you can discuss this also with the client and how much stress the child actually feels. It's good to ask the child and not the parent that is with them, because this is a personal question. Okay, soft drinks or sugar items. So you can ask them, do you drink soft drinks? And it's yes or no. If they drink Coke, Coke will go here, but it'll also go in the coffee, as it has caffeine. Sugar items. How many sugar items? This child, let's say, has an ice cream a day, some cookies a day. Even if a person says that they don't have any sugar per day, we always put 1 either way. But this child, let's say he has some cookies and some ice cream per day, so we'll put 3. Usually children do some kind of extracurricular activity, so they usually do at least 3 times a week. But we could always ask, especially the teenagers, because the teenagers have a lot of studying to do, so maybe they don't do so much exercise. Alcohol, here, okay, this child here that's 6 years old does not drink alcohol, I hope. But you could always ask the teenager if they go out, how much they may drink. If they drink an occasional beer here and there, it's okay. But if someone drinks 7 drinks on a weekend, it is on average 1 a day. So you'd put 1 here. So, okay, this child doesn't drink coffee and it doesn't drink Coke. So this will be 0. Extreme toxic exposure per year, radiation, etc. Okay, in general, we usually put 1 because they live in a city. Okay, there's a lot of radiation, etc. We could always ask if someone works with chemicals and touches a lot of chemicals. Here, this number would go up. In general, I don't want to put too many numbers here too because I want the device to actually tell us how much toxicity there is around them, and the device will tell us. Okay. Injuries in the past, we discussed this in the beginning with the organs removed, and if they've gone through psychological traumas as well, we'd go through that, or if they've broken their bones, hit their head seriously, etc. Major infections past and present, that in all their life, if they've gone to the hospital, let's say for a major infection, pneumonia, or some other kind of bladder infection, kidney infection, or whatever, that would be here. How much water do they drink? Okay, for a teenager and up, they should drink 5 glasses a day, but for a 6-year-old, okay, maybe 3 a day. That's pretty normal, even though it's red, but it's normal for a 6-year-old. You can always put here how much weight they feel like they lost, they're overweight, but make sure if you put a number here, also in the other panel, the previous panel, as a doctor or as a therapist, you have to put your belief there too. Otherwise, the program will calculate it as if there's an eating disorder if they aren't the same there. So, well, we have to check about that. So, when we're finished with this SOC index, we close here and it's automatically saved. Okay, we can go directly into calibration, and now it's much easier to load a picture. You don't have to change it into BMP file. It could be a JPEG file. So for my purposes and for privacy reasons as well, I'll load my picture even though we're doing a child, just to show you. I like loading a picture because you can see the before and after. There is a difference when a person first comes in their expression, in their face geometry, in the whole face structure in general. You could see a difference from session to session, and people like to see it. They like to see the difference because a picture says 1,000 words. So we load the picture. Okay, I took this by myself, so it kind of looks funny. So fast track calibration.